Hi friends, I'm Dr. Adarsh Annapareddy. I'm an orthopedic surgeon at Sunshine Hospitals. Today I'm going to talk about a topic which a lot of people are asking me about, and a lot of people are suffering from this problem, especially the IT crowd and also doctors themselves. A lot of these people are suffering from something known as vitamin D deficiency. So what is vitamin D? First of all, we keep hearing about this thing, vitamin D, but what exactly does it do? Most people do know that calcium is very important for the strength of a bone. So when you ingest calcium and when you have more calcium in the bones, obviously the bones will be stronger. So where does this vitamin D come into play? I like to think of vitamin D as an Ola cab or an Uber. So what I mean by that is when we ingest calcium in the form of food or in the form of supplements, it goes into the stomach. But from the stomach to the bloodstream and then from the bloodstream to the bones, it needs a carrier. It doesn't go on its own. So what this vitamin D does, it goes and takes the calcium from the stomach and it transports it like an Uber cab to the bones. So finally, the bone strength depends on the presence of vitamin D as well as calcium. If you just take calcium alone, it's not going to reach the bones. The vitamin D is required to bring the calcium to the bones. That's why vitamin D is very important. Deficiency of vitamin D is known as osteomalacia, and much more severe forms is known as osteoporosis, which happens in much older people. So osteomalacia is a much milder form of vitamin D deficiency. In osteomalacia, it can happen in a younger age group as well. And as I said, it happens a lot in IT professionals who are don't get much physical activity, don't get much of natural sunlight, and also don't have very regular food habits. What are the symptoms of this vitamin D deficiency or osteomalacia? So you may feel very vague pains in the body, in the bones, in the muscles. You may feel generalized body pains, and you may feel a lot of fatigue and lethargy. This may be because of vitamin D deficiency. How does sunlight have any bearing on this vitamin D? So the active form of vitamin D is 125 dehydrocholesterol. So in our skin, everyone's skin has an inactive form of this 125 dehydrocholesterol. And what happens is when the skin is exposed to the ultraviolet rays of the sun, this inactive form of vitamin D gets converted into the active form. And then that can start absorbing the calcium into the bloodstream and into the bones. That's why sunlight exposure is very important, and that's why doctors who hardly get any sun exposure and even IT professionals who don't get much of sun exposure are more prone to vitamin D deficiency. So obviously, to counter that, try to get at least half an hour of sun exposure before 8 AM, because after 8 the ill effects of the sun rays can also be seen on the skin, but before 8 the sun rays are soft, so they don't cause harm to the skin and they get the benefit of vitamin D generation in the bloodstream. That's the first way to prevent osteomalacia, is sunlight exposure. The second thing is having a good vitamin D and calcium rich diet. So a lot of foodstuffs do have a good amount of calcium and vitamin D, like milk and milk products like yogurt and cheese, and also green leafy vegetables are also very important. Despite all of these, sometimes the levels are so low that we still need to take supplements. So there are capsules, and you get a lot of different types of capsules. All of them are pretty good, and they usually come in a combination of calcium along with vitamin D. So take the combination tablets so you don't have to take two different types. Another important thing to prevent weakness of the bones is physical activity. So some people may think that the more activity we have puts more load on the bone, therefore weakening the bone, but it's actually the reverse. If you do keep doing a lot of good physical activity, at least 15 to 20 minutes minimum a day, like some weightlifting or some kind of a walking, that helps the bone to start regenerating even faster and get a little stronger. Osteoporosis is a severe form of vitamin D deficiency. It literally means the bone. Osteo means bone. Porosis means becomes porous. So that means it becomes very soft and spongy. The density of the bone becomes very, very low. This happens usually in the older age group above 50, especially in women, post-menopausal women especially, because once the estrogen levels drop in the bloodstream, the bone strength becomes very, very weak. And the bones become so soft and spongy that even a sneeze or a cough can cause fractures. So the rib fractures and the vertebral spine bone fractures can also happen, and also hip fractures are very common in these patients. How do you diagnose osteoporosis? There is a test known as a DEXA scan, which helps it takes a scan of the body and tells the density of the bones. If your DEXA scan value, the T-score is less than 2.5, that means you have osteoporosis. So once you have osteoporosis, again, as I said, the treatment is similar to osteomalacia, but in higher doses of supplements are required. And sometimes even those supplements are not enough. We have to give some medicines known as teriparatide or bisphosphonates, which will strengthen the bone. And in very severe cases in postmenopausal women, we may need to do hormone therapy, where we give estrogen to the patient to strengthen the bones. In these patients, as I said, fractures are very common and can happen with the minute movements also. Just by sitting suddenly on the chair or with a cough or a sneeze, fractures may happen. So first of all, you have to be careful. Secondly, if the fracture does happen, sometimes we may have to fix it. So friends, as I said, vitamin D is very important for the body along with the calcium. So the bone strength depends on these things. So sunlight exposure, good food habits, physical activity, and supplements will definitely help to prevent bone weakness.
Sunshine, it's my sunshine.